Hello, welcome to the skin cancer presentation. My name is Pamela Kevitch and I am the Senior Health Promotion Specialist at SummaCare, and I will be your host. During this presentation on skin cancer, we will discover who is most susceptible, what are the common types, why you should catch it early, how to spot a suspicious mole, and review preventive measures. Here are the 8 dimensions of wellness. While all dimensions of wellness need our attention, there doesn't have to be balance among all dimensions at a given time. Instead, the goal is to find harmony with the dimensions that are most authentic to you in the moment. This presentation will focus on the physical domain through the adoption of healthy habits and avoiding or minimizing risky behaviors. Skin cancer is the most common cancer in the United States. It is estimated that approximately 9,500 people in the U.S. are diagnosed with skin cancer every day. More people are diagnosed with skin cancer each year in the U.S. than all other cancers combined. At least 1 in 5 Americans will develop skin cancer by the age of 70. And the annual cost of treating skin cancers in the U.S. is estimated at $8.1 billion, about $4.8 billion for non-melanoma skin cancers and $3.3 billion for melanoma. Current estimates, again, are that 1 in 5 Americans will develop skin cancer in their lifetime. And skin cancer can affect anyone, regardless of skin color. Skin cancer in patients with darker skin tones is often diagnosed in its later stages when it's more difficult to treat. There's more than meets the eye when it comes to skin cancer, so make sure you know all the facts. Who is at risk? Anyone can get skin cancer, and there are items listed here on the slide, but it's more common in people who have the following characteristics. Spend a lot of time in the sun or in a tanning bed or have been sunburned. They have light-colored skin, hair, and eyes. Typically are over the age of 50. Have a family or personal history of melanoma. Have a family history of unusual moles. Have been exposed to certain factors in the environment, such as radiation and various chemicals, and or possibly have a weakened immune system. Here are the 3 main types. Basal cell carcinoma, squamous cell carcinoma, and melanoma make up the vast majority of all skin cancers. These 3 cancers have several things in common. First, they are predominantly linked to excessive exposure to ultraviolet or UV rays, either from sunlight or tanning beds. Next, they are all associated with many of the same additional risk factors, including fair skin that freckles or burns quite easily. However, when treated at the earliest stages, they are almost always curable. Basal and squamous cell skin cancers are the most common cancers of the skin. Melanomas are cancers that develop from melanocytes, the cells that make the brown pigment that gives skin its color. Melanocytes can also form benign, non-cancerous growths called moles. Melanomas are not as common as basal cell and squamous cell skin cancers, but they can be far more serious because they are more likely to spread to other parts of the body where it can be very difficult to treat. So let's dive down a bit deeper. Basal cell carcinoma is the most common type of skin cancer that accounts for an estimated 80% of all cases of skin cancer. This cancer develops in basal cells, which are located in the outermost layer of our skin, known as the epidermis. Basal cell carcinoma generally appears in areas of the body that are habitually exposed to the sun, particularly the face, ears, neck, scalp, shoulders, and back. Sometimes the backs of our hands can also be a trouble zone. Basal cell cancer grows very slowly. However, left untreated, a growth can widen and deepen significantly, becoming unsightly or causing functional problems. People who develop basal cell cancer are more likely to have reoccurrences over time. One common sign is a slowly growing, non-healing spot that sometimes may bleed. People of all skin tones develop basal cell carcinoma. However, again, people who have light skin that rarely tans and tends to freckle, they have red or blonde hair, and light-colored eyes have a greater risk of developing this type of skin cancer. Before basal cell carcinoma develops, people with lighter skin tones often notice signs of sun damage on their skin, such as age spots, patches of discolored skin, and sometimes even deep wrinkles. These signs can develop years before the cancer. Next, squamous cell carcinoma. The squamous cell carcinoma incidence has increased up to 200% in the past 3 decades. Squamous cell cancers account for around 20% of all cases of skin cancer. This cancer usually begins when ultraviolet UV light from the sun or tanning beds badly damages the skin. The body tries to repair this damage. However, when it can no longer repair all of the damage, changes called mutations develop in the skin's cells. These mutated cells are cancer cells, which pile up and form a cancerous tumor. It tends to develop on skin that's had a lot of sun exposure, such as the rim of ears, lower lip, face, balding scalp, neck, hands, arms, and legs. This cancer is usually not life-threatening. In most patients, it tends to grow slowly. However, while this cancer tends to grow slowly, without treatment, it can grow deep. And once it grows deep, treatment becomes more difficult. Melanoma, what to look for. Malignant melanoma is a serious form of skin cancer. While it is less common than basal and squamous cell carcinomas, this skin cancer is more dangerous because of its ability to spread to other organs more rapidly if it is not treated at an early stage. When skin is exposed to ultraviolet UV radiation from the sun or tanning beds, again, it causes that skin damage to trigger those skin cells to produce more melanin. Melanoma occurs when the DNA damage from sunburns or tanning is due to that UV radiation, again, triggering those changes or mutations in those skin cells, resulting in uncontrolled cellular growth. Melanomas present in many different shapes, sizes, and colors. That's why it's tricky to provide a complete set of warning signs. So you definitely want to look at the following things. A mole on the skin that is growing, changing shape, or changing color. May look like a new mole, freckle, or age spot. May be a slowly growing patch of thick skin that looks like a scar, jagged border, more than one color. Again, you see that it's growing. May appear with a dome-shaped growth that feels firm, and it may look like a sore, and it may even bleed. Maybe you're noticing dark brown or black vertical lines or streaks beneath a fingernail or toenail, or a band of darker skin around a fingernail or toenail. Definitely be aware of a mole that looks scaly, oozes, or bleeds, and is painful and or itchy. And another common thing to be aware of is maybe you've noticed a bruise on your foot that does not heal. Here's some statistics. Melanoma accounts for 6% of new cases in men and 4% of new cases in women. Only 20 to 30% of melanomas are found in existing moles, while 70 to 80% appear on normal skin. An estimated 200,340 cases of melanoma will be diagnosed in the US in 2024, with an estimate of 8,290 people, which breaks down to 5,430 men and 2,860 women dying of melanoma. Certain types of unusual moles increase the risk for melanoma, so definitely be aware. A large number of moles increases the risk as well, as does overexposure to UV rays from sunlight and tanning beds. And on average, a person's risk for melanoma doubles if they've had more than 5 sunburns. Melanoma ABCDE. The first 5 letters of the alphabet are a guide to help you recognize the warning signs of melanoma. A is for asymmetry. Most melanomas are asymmetrical. If you draw a line through the middle of the melanoma, the 2 halves don't match. B is for border. Melanoma borders tend to be uneven and may have scalloped or notched edges, while common moles tend to have smoother, more even borders. C is for color. Multiple colors are a warning sign. While benign moles are usually a single shade of brown, a melanoma may have different shades of brown, black, tan, and as it grows, the colors red, white, or blue may also appear. D is for diameter. While it's ideal to detect a melanoma when it's small, it's a warning sign if a lesion is the size of a pencil eraser or larger. So the size of a pencil eraser is approximately about 1/4 inch in diameter. And last, E is for evolving. Any change in size, shape, color, or elevation of a spot on your skin or any new symptom in it, such as bleeding, itching, or crusting, may be a warning sign of melanoma. If you notice any of these warning signs or anything new, changing, or unusual on your skin, seek an appointment with your healthcare provider. So when should you seek medical attention? You definitely should make an appointment with your healthcare provider if you notice any changes to your skin that worry you. Not all skin changes are caused by skin cancer, and your healthcare provider can investigate your skin changes to determine a cause. Upon an examination of the area of concern, you will be asked about your family history, medical history, and sun exposure. If they suspect skin cancer, you will most likely be referred to a dermatologist. To diagnose skin cancer, a dermatologist may do one or more of the following. First, examine your skin. A dermatologist will look at your skin to determine whether your skin changes are likely to be skin cancer, and further testing may be needed to confirm that diagnosis. To remove a sample of suspicious skin of testing or a skin biopsy, your provider may remove the suspicious looking skin for lab testing, and a biopsy can determine whether you have skin cancer, and if so, what type of skin cancer you have. If your biopsy or skin sample comes back positive, you may need to receive additional tests like imaging and blood tests to help identify the extent of the cancer. A lymph node biopsy may be performed to see if it has spread to nearby lymph nodes. So what are the biopsy options if needed? The type of skin biopsy you have will depend on your symptoms and how much skin is affected. First, shave biopsy. A tool-like razor is used to scrape the surface of your skin. Punch biopsy, a round-tipped cutting tool, is used to remove a small core of skin, including deep layers. And last, an excisional biopsy, a scalpel is used to remove an entire area, and including that irregular skin surrounding. An excisional biopsy, that procedure takes approximately 15 minutes in total preparation to bandage. And all biopsies are sent to a laboratory to determine whether the spot is cancerous or not. So let's dive a little deeper into these biopsy options. So here's an example of a shave biopsy. And again, a shave biopsy gathers a cell sample from the top layers of the skin, and these layers are called the epidermis and the dermis. Most often after this procedure, a Band-Aid is usually applied. However, there are some instances where, stitches may be required. Here is an example of a punch biopsy, and the punch biopsy sample might include tissue from layers called the epidermis, the dermis, and the top layer of fat under your skin. You may need stitches to close the area to avoid any infection and promote healing. Next, here is an example of the excisional biopsy. The excisional biopsy sample of removed tissue might include a border of healthy skin and your skin's deeper layers. You may need stitches to close this area as well to avoid infection and promote healing, dependent on the size of the sample. Here are some treatments that a dermatologist may consider should you have a positive skin biopsy result. First, cryotherapy. It is used to destroy small early skin cancers, essentially by freezing them with liquid nitrogen. Excisional surgery. In addition to the biopsy, there might be cutting out additional cancerous tissue and the surrounding margin of healthy skin. Electrodesiccation is the scraping away of the layers of cancer cells using a device with a circular blade, and then the dermatologist follows with an electric needle to destroy any remaining cancer cells. Chemotherapy in the form of creams or lotions containing anti-cancer agents may be applied directly to the skin, and systemic chemotherapy can be used if it is discovered that the skin cancer has spread to other parts of your body. And last, photodynamic therapy destroys the cancer cells with a combination of laser light and drugs that makes the cancer cells more sensitive to light to be able to destroy them. Prevention. Prevention is the key to avoiding skin cancer. Wear protective clothing and wraparound sunglasses that provide 100% UV ray protection. Stay out of the sun when it's at its strongest between 10 a.m. and 4 p.m. Use a sunscreen with an SPF of at least 30. And don't forget about sunlight through windows, both at your home and in your car. Avoid tanning beds at all costs, regardless of age. So how should you select a sunscreen? When selecting a sunscreen, make sure the label says the following. First, broad spectrum. The words broad spectrum means that the sunscreen can protect your skin from both types of UV rays, UVA and UVB rays. SPF 30 or higher. The American Academy of Dermatology recommends that you select a sunscreen with an SPF rating of 30 or higher. SPF stands for Sun Protection Factor. The number tells you how long the sun's UVB rays would take to redden your skin if you apply the sunscreen as directed versus no sunscreen at all. So if you use an SPF 30 product properly, it would take you 30 times longer to burn than if you used no sunscreen. And last, water resistant. Dermatologists also recommend that you look for the words water resistant. This tells you that the sunscreen will stay on wet or sweaty skin for a while before you need to reapply. Water resistance lasts typically 40 to 80 minutes. However, not all sunscreens offer water resistance, so be sure to read the bottle and the recommendation for reapplication. Sunscreen must also be reapplied throughout sun exposure. Apply 1 ounce, which equates to about 2 tablespoons 30 minutes before going outside, and reapply it every 2 hours or immediately after swimming or sweating. No matter the SPF, reapplication every 2 hours is really the key. And keep in mind that while crucial, sunscreen alone is not enough. Seek the shade whenever possible, wear sun-safe clothing, a wide-brimmed hat, and UV-blocking sunglasses for a complete sun safety strategy. Sunburns. Sunburns are a sign of skin damage. Suntans aren't healthy either. They appear after the sun's rays have already killed some cells and damaged others. So who is most at risk? People who work or play sports outdoors have a greater risk of frequent sunburns that can result in skin cancer. And as mentioned, some people are more prone to sunburns. Skin type determines your susceptibility, but anyone can get burned. Even without a burn, sun exposure raises skin cancer risk. Even if you don't redden, the sun can cause cellular damage that can lead to cancer. The UV index is a factor. A high UV index means that unprotected skin will burn faster and more severely, so be careful, especially when the sun is at its strongest. You can burn on an overcast day, so be careful. Even when the sun isn't shining, up to 80% of UV rays can penetrate the clouds. Light pink is still bad. No matter how mild, every burn is a sign of injury to your skin that can result in premature aging and skin cancer. What are some take-home thoughts? Lifestyle prevention, avoiding the sun between 10 a.m. and 4 p.m., choosing protective clothing when out in the sun. And last but not least, thinking about a broad spectrum waterproof sunscreen with an SPF of 30 or greater. Don't forget the sunglasses and the wide-brimmed hats. Early detection. Check your skin regularly for any types of changes in birthmarks, moles, and spots. You definitely want to look for size, shape, color, feel, and if you notice anything that does not look correct or you have any suspicions, follow up with your healthcare provider. SummaCare resources. We definitely encourage everyone to have an annual visit with your primary care provider. We offer condition and care management if you are diagnosed with a chronic condition or have complex needs, as well as we provide access to diabetic testing supplies. We offer telephonic health coaching for lifestyle behavior management. You have access to WebMD Health Manager through Plan Central. We do offer a 24-hour nurse line where our SummaCare nurses are available 24/7, 365 to answer medical questions. We do offer Teledoc Health, which is a telemedicine feature. So while you're traveling or in need of minor or medical issues or concerns, you can call in and speak to a healthcare provider. We do offer Quick Care, which is our smoking cessation program, which is a telephonic program, and we do offer limited nicotine replacement therapy. And last but not least, you do have access to Husk Health and Wellness discounts, which gives you access to discounted health club memberships, nutrition programs, and educational resources. Thank you for joining me today for the skin cancer presentation. And here are the resources that were used to create my presentation for you. And as always, feel free to follow SummaCare on any of the listed below social media outlets. Thank you and be well.